Well, the impact the coronavirus pandemic has had on children is the focus of a report released today, with Rhode Island ranked in the middle of the scale nationally.
12 News reporter ANITA BAFFONI joining us now with the details on how Rhode Island kids are faring.
Well, Rhode Island ranks 25th in this nationwide study that looks at mental health in kids nationwide, and now the pandemic's impact on mental health is being called a pandemic in its own right. During the coronavirus pandemic, school chairs remained empty for months while states moved to distance learning, and that was a contributing factor to the mental health crisis advocates say the nation is in. Head of the Boys and Girls Club in Warwick said she saw the impacts of this firsthand.
You know, there's growing pains. I think it's a long-lasting effect. I don't think it's going to be a quick fix.
A report done by the ANITA Foundation found roughly 15% of Rhode Island kids experienced anxiety or depression in 2020 when the pandemic hit, compared to nationwide, which jumped to 26%.
So they weren't in their schools, they weren't able to play sports, they weren't able to go to places like movie theaters, or malls, or cafes, or playgrounds for quite a bit of the pandemic. So they just didn't have that connection with their peers.
The report also found racial and ethnic disparities contributed to disproportionately troubling mental health conditions among children of color. 26% of American Indians in high school attempted suicide nationwide. That number is 23% for gay, lesbian, or bisexual students.
We have to train our staff now on looking for signs of suicide.
Rhode Island ranks 25 compared to Massachusetts, which ranks first in the nation in children's well-being. Diotuano says more resources are needed in Rhode Island to help kids access mental health services.
They have to invest in getting our kids well. Who else is going to do it?
And those resources she was referring to includes having more mental health counselors in schools. And it's worth noting that children's struggle with mental health started before the pandemic, according to this report, but only worsened as the coronavirus spread and impacted in-person learning. For now, live in North Kingstown, I'm ANITA BAFFONI, 12 News.
The mental health of children in Rhode Island is faring better than 25 other states in the country. That's according to a new nationwide report. Massachusetts came in #1. The RI Kids Count report found that more than 1 in 7 children experienced anxiety and/or depression in 2020, the year the pandemic hit. With those struggles continuing for so many, the report also makes recommendations on how to help children. 12 News reporter ANITA BAFFONI joins us now with the details. ANITA?
Well, Shannon, experts say children are facing a mental health crisis spurred by the coronavirus pandemic, and some advocates warn that the impacts could be long-lasting. The impacts of the coronavirus pandemic are now spurring a new pandemic, according to experts, and that's around children's mental health. Distance learning and being away from their peers is one main cause.
There's a huge social, emotional catch-up that needs to happen, and I don't think that the kids have gotten that yet.
Laura Diotuano runs the Boys and Girls Club in Warwick. She says children are struggling to get back to what we once knew as normal. She and other advocates are pleading with leaders for a renewed focus on mental health services for kids.
We have kids that are looking to go to counseling, looking to gain the strategies they need to get those social, emotional skills, but they can't get in.
We are very concerned about things like the lack of adequate mental health providers in schools.
A report done by the ANITA Foundation found roughly 15% of Rhode Island kids experienced anxiety or depression in 2020 when the pandemic hit, compared to nationwide, which jumped to 26%. The report also found racial and ethnic disparities contribute to disproportionately troubling mental health conditions among children of color. 26% of American Indians in high school attempted suicide nationwide, according to the report. That number is 23% for gay, lesbian, or bisexual students.
This is going to have long-lasting effects, and I'm scared.
And Rhode Island's Kids Count says that the state is far below the recommended number of psychologists in schools, one way they say to help boost Rhode Island's ranking. For now, live in North Kingstown, I'm ANITA BAFFONI, 12 News.